Hey guys, it's part 2 of questions and answers. We had great responses online from people watching the video, and I got a lot of other follow-up questions, so I want to do a part 2 to answer some of those. Thanks to everybody for all the positive comments we've gotten on Facebook and on YouTube. If you do have questions that you want answers for, shoot them my way, put them in the comments section on the feed below. So let's get started. Lower abdominal pain when you're pregnant, that round ligament pain. We hear that question a lot. First thing, it's really common, of course. Almost always, it's nothing to worry about. It's typically associated with either the uterus growing rapidly or the ligaments that support the uterus, which are called the round ligaments, stretching and causing pain, and that's why it's called round ligament pain. Number one, if the baby is moving good, if you're far enough along to feel movement, that's great. If there's no bleeding, and if it doesn't sound like preterm labor, so you're not having contractions that feel like they're coming and going every 5 minutes for an hour, that I would definitely check out. Bleeding for sure, get checked out. But if it's none of those things, you otherwise feel well, no fever, no other symptoms that might indicate other problems like, say, gallbladder pain in the right upper quadrant, or maybe appendix pain in the right lower quadrant specifically, especially with fever and decreased appetite. If you don't have any of those things, it's almost always fine. Some people like to try to use the belly band. A belly band could be helpful in this situation, gives you some support to the lower abdomen, so maybe try one of those. You can get them online. Palpitations in pregnancy. It's really common in pregnancy to feel your heart skip a beat every now and then, maybe more so than when you're not pregnant. There's several reasons why that might be, one of which is that your heart is actually working harder when you're pregnant. It's pumping more blood every minute by about 30% than when you're not pregnant. Sometimes that's enough just to cause some irritability. You get an extra little beat here and there. Those are almost always harmless. The one that I always ask patients about, and this is really about the only one to worry about, is if you get a run of rapid heartbeats. So you're just minding your own business, everything's fine, and then all of a sudden, really skippy heartbeat, really, really fast, especially associated with feeling dizzy. If you get that type symptom, we're definitely going to want to get your heart checked out. We usually do what we call a Holter monitor. A Holter monitor is a way to check that out. It's going to measure the electrical activity in your heart for 2 or 3 days consistently, and you have a little button to hit. You hit the button when you feel your symptoms, and then they can correlate that to what they're seeing on the EKG at that time to see if there's anything that's concerning going on. But I will tell you that it's almost always normal, and I really don't worry about it unless it is significantly symptomatic. Dizziness or lightheadedness, that's also really, really common in pregnancy. Really at any time during pregnancy, it's very common to feel lightheaded or dizzy. There's a lot of reasons why it might be. It's almost always normal. A couple things to look at are, well, did you actually pass out? Did you fall down and hit the ground? That's different. That needs evaluation. If you have that, just go to the emergency room and get checked out. Don't even need to call, just head in. But if it's just you feel dizzy when you stand up, maybe you get a little lightheaded if you're standing around for too long, it's probably just a little drop in blood pressure. That's very, very common in pregnancy. That's primarily because all the blood vessels in your body dilate when you're pregnant, and that lowers your blood pressure. So if I see people running low blood pressure in the office and they're complaining of feeling dizzy or lightheaded, I recommend 2 things. Number one, hydrate like crazy, drink lots and lots of water. Keep that blood pressure up with hydration. You can add a little bit of salt to your diet. I wouldn't go crazy with the salt shaker, but even just like 1 bag of chips a day or something like that might be enough to make a difference. And then of course also common sense, stand up slowly. Make sure you have a hand on the chair before you stand up, because if you feel bad, you can steady yourself and you can sit back down until it passes. Headaches in pregnancy, super common. Get this one almost every day. It seems like it's most common in the first trimester. It's probably the hormones of pregnancy. Your hormones are going nuts when you first get pregnant. Everything is on the rise. That probably triggers headaches through changes in the blood vessels in your brain. That can give you a pretty bad headache. A lot of those are just going to have to go away on their own. Tylenol is safe. You can use it. It usually doesn't work, but you can try it. Some other things that can contribute to headaches, though, are possibly controllable. Again, hydration is the key. If you're getting dehydrated, that blood pressure gets lower, that could trigger a headache. Also, making sure that you're eating, not just 3 meals a day. Don't think about 3 meals a day when you're pregnant. Think about just kind of small, frequent snacks throughout the day. If you get long enough between meals, you will start to metabolize fat. Fat metabolism triggers release of something called ketones, and ketones can trigger a headache. So if you ever see anybody who's doing a ketogenic diet, it's like an Atkins diet, one of their main complaints is headaches. So make sure. You can actually get urine dipstick tests at the pharmacy, and you can dip for ketones. If you're seeing ketones, then you definitely need to eat more and eat more frequently. That may help with your headaches too. Making sure you've got plenty of rest also helps. And then a lot of times they just have to run their course and go away. The one that we're the most worried about with headaches is when it's the worst headache of your life. You really shouldn't be getting the worst headache of your life as a pregnant person, and there definitely are some things that it could be. The big one we think about, of course, is your blood pressure. That's going to be more of a thing after, say, 22, 23 weeks and beyond, less of a thing earlier. If you've got the worst headache of your life and you're 10 weeks pregnant, it's probably not your blood pressure. But there are other things that could happen. If you're in first trimester of pregnancy with the worst headache in your life, you need to go to the emergency room. You can get blood clots in the big blood vessels in your brain, and they can cause a pretty massive headache. The hormones of pregnancy can trigger increased clotting factors that can lead to a clot. But I'm talking worst headache of your life, not just a headache that won't go away. If you have the worst headache of your life, best advice, go to the emergency room. Now, if you're after about 20 weeks, they're going to send you up to labor and delivery. We're going to be looking at that blood pressure. We're still going to think about that other thing in terms of blood clot risk. Sometimes you're going to have to get an MRI. MRI in pregnancy is safe, so if we need to do it, it's okay. Shortness of breath in pregnancy, I hear it every day. Physiologic dyspnea of pregnancy. What that means is you're short of breath because you're pregnant. As your uterus is growing, it's expanding your abdomen, it's pushing up your diaphragm, so your diaphragm has less room to travel. It's a little bit harder to breathe. You also have changes from your brainstem, which controls the breathing settings when you're not thinking about it. And that change in breathing settings that happens in the background without your conscious thought is noticed by your conscious mind, and the sensation is of shortness of breath. You also hear a lot about somebody who, say, walked up the stairs to get to the office today and that made her short of breath. This is likely just to be some of the physical changes of pregnancy, maybe getting a little bit out of shape from not exercising as much when you're pregnant. That can also do it. So most of these things are normal and not anything to worry about. The one that I tell people to watch out for, and this is one of those go to the emergency room type deals, is sudden chest pain, especially right here, sort of central chest pain associated with shortness of breath, and especially if it's pain that's worse with a deep breath. There is one real problem that can occur in pregnancy that is related to blood clots forming in the legs and the veins in your legs that can break off and go to your chest. That's called a pulmonary embolism. It's a big deal, and pregnancy does increase the risk of blood clots. So if you've got sort of, again, worst chest pain of your life, worse with a deep breath, and associated with shortness of breath, that's one of those go to the ER moments. You don't even need to call. I mean, you can call them and tell them you're going if you want to, but just go. Bleeding in early pregnancy, and just bleeding in general in pregnancy. One easy rule of thumb is if the bleeding that you're seeing is less than a period, if it's just spotting, it's almost always fine. If your bleeding is like a period or heavier than a period, it's almost never normal. So just keep that in mind. Less than a period, you're probably fine. Like a period or more than a period, that needs to get checked out right away. Now, it's not to say that you couldn't have a problem with some spotting, but it's just a lot less likely, and spotting in pregnancy is so common anyway that most of those people are going to be okay. So if your blood type is Rh negative, say you're O negative, A negative, whatever, negative, do need to let us know, because we need to give you a dose of what's called RhoGAM that reduces the chance of having any interactions between the baby's blood type and your blood type. So if you're Rh negative and spotting, at any point we want to hear about it. If you're Rh positive and it's only spotting, I'm not too concerned about that, especially if you're not feeling abdominal pain, you're not having contractions. If you're far enough along to feel the baby move and the baby's moving good, everything's probably fine. But bleeding like a period needs to get checked out for sure. Give us a call. Or if you're over 20 weeks, just head to labor and delivery, because you're going to need to get checked out. Rashes and itching, especially on the belly. There is one specific problem here again that can be an issue, and the same complaint. It's always the same. It's palms of the hand, soles of the feet. If you have burning or itching on those two areas and you're pregnant, it can be one particular thing, IHCP, intrahepatic cholestasis of pregnancy. It is a liver dysfunction that occurs that is pregnancy induced. It's somewhat of a mystery. Why does it happen? There seems to be genetic tendencies for it. It tends to recur in pregnancies if you've had it in the past. It is still fairly uncommon. About 1 in 1,000 people will get it. Although I seem to see it 4 or 5 times a year, if not more, so maybe it's more common than that, but that's what the textbook says. But it's always the hands and the feet, the palms and the soles. If you have those, we need to do a blood test to check what we call your bile acids. If it's not that, it's almost always not a big problem. Now there is one that's a bad rash on your abdomen. It's called PUPS, P-U-P-P-S. And that one sometimes responds to steroids or steroid cream. It's not as big of a deal as the intrahepatic cholestasis, but it is extremely annoying for the patient. It drives you nuts. It's so itchy. So there are some medications we can use in that situation. So if you have a visible rash that's kind of blistery, it's almost always in the stretch marks. It usually starts centrally and it can expand like down towards your legs. Delivery is the cure. So if you are term, that's great news, because then there's an option there. If you're not term, we're going to have to manage it medically until we can get you till a safe time to deliver the baby. Fetal activity, that's one that everybody is very concerned about. Of course, you want to feel the baby move, and if you have been feeling the baby move and now all of a sudden you can't feel the baby move, and really it's not until 28 weeks where you can even reliably do what we call kick counts, where you sit and feel the movement. So if you're, say, between 23 and 28 weeks, you should feel movement every day. You probably don't need to be doing kick counts yet. It's a little too soon. If you're less than 23 weeks, if you're feeling movement in general most days, you're good. And I wouldn't worry about it if one day you couldn't. If you're less than 23 weeks, as long as in general you're feeling movement, and then if the next day you're feeling it, we know you're fine. You just may not feel reliable daily movement that early. The baby's small, maybe they've got their back turned away from you, you're not feeling the movement. Also, people who have an anterior placenta, so that's the placenta that, hang on, I'm going to show you. This is the uterus. If your placenta is on the anterior surface between your abdominal wall and the uterine cavity, you're going to feel the baby less. I'm not even showing you the uterus. Let's try that again. So this is an anterior placenta right here. This is the baby. That happens to be a penis. So if we're shooting from up here with the ultrasound in your abdominal wall, the first thing you see is the placenta. Then comes the baby. The baby's being blocked by the placenta here. You might not feel movement as much. Also, if you have an anterior placenta, you probably won't get this nice picture of a face here, because there's nothing in the way of this face. If the placenta's here, you can't see it. But just like it's hard to see, it's also hard to feel. And so that can block some of the movement and makes it more difficult to feel the baby moving on a reliable basis until about 28 weeks, and that's where the kick count thing comes from. Kick counts are useful after about 28 weeks. The original study, which was published out of Yale University a long time ago, looked at fetal activity. They did ultrasound for 24 hours at a time, which is crazy, and monitored fetal movement. And pretty reliably, you can definitely get 10 movements in 30 minutes to an hour, pretty much any time of day. So if there's a day where you don't think the baby's moving as well, sit down, have a snack, have something to drink, and turn everything off and just feel your belly and sit there and feel for the baby. And if you can feel 10 movements in an hour, that's what kick counts are. That's a good result. If you can't feel that, you can maybe give it one more hour. If you're still not reliably getting it, it's worth giving us a call. We're going to want to monitor the baby. One last question that we get a lot is this medication safe in pregnancy? Is that medication safe in pregnancy? What do I take when I have a cold? It's a long list. We tried to put together a good list on our website. I will put a link down in the comments section, links you to our webpage that shows you the safe meds in pregnancy. Big ones: avoid aspirin, ibuprofen, non-steroidals, Toradol, stuff like that. Can affect the baby's circulation in the heart. You definitely want to avoid that. Tylenol is your pain med if you're pregnant. All the over-the-counter cold meds are fine. I would avoid Sudafed in the first trimester, but otherwise it's fine. Constipation, you can use Colace, milk of magnesia, stuff like that. All the heartburn meds are fine. Pepcid, Zantac, all those are all good if you have heartburn. If you have others, just look on the list that's provided on the website. Okay, guys, well, that's part 2 of questions and answers. Hope you enjoyed it. If you have questions, put them in the comments below. Who knows? Maybe we'll make a part 3 sometime. Thanks for watching. Take care.